Thank you for joining us today on MTVA Unscripted. My name is Dr. John Rodas. I'm the president of the Moving to Value Alliance and the president of Arista Health, LLC. I'm joined today by my colleague, Dr. Steve Schutzer, who is the president of Upswing Health and co-founder of the MTVA, and Lisa Trumbull, president and CEO of Stone Health, the clinically integrated healthcare network in Connecticut and Massachusetts. We're honored today to have our guest, Dr. Scott Conard, who is a family practitioner with more than 30 years experience. We're intentionally keep our intros short, but Scott's the author of several books, one of which I have right here on my desk, Which Door? Solving Corporate Healthcare Costs, Improving Employee Well-Being. He's also written several other books, and he's the co-founder of Converging Health. So Scott, welcome. Thank you for joining us today.
John, thank you so much. I'm really honored to be here.
Scott, we've all arrived at this, moving to value space through different ways in all parts of the healthcare ecosystem. So if you don't mind sharing with our audience kind of your journey of how you got here today.
Let's start backwards for now and go back. And I'll just say that some of the most important things to me are when I look at data, real data, and I see things like decreased heart attacks rate, decreased stroke rates, diagnosing cancer early at stage 1 instead of stage 3 and 4. I do the happy dance, and I appreciate so much corporate executives who have the leadership to make that happen. Recently, at the retirement of one of the executives at Hilti, he said, my goal was to take this company, Hilti North America, and get it over $1 billion, and we did that. And I thought that would be the highlight of my career, but the highlight of my career was working with our health benefits team, ironically, and seeing our heart attacks go from 15 a year down to 2 a year, seeing the cancer that was diagnosable, the screenable cancer, go down to no cases 1 year of stage 3 and 4 colon, breast, cervical cancer. And he said, I've had so many employees come and say, when you changed the health benefits, I was angry because you made me do things. And I didn't want to do things because in the plan benefit design, they had to go to a primary care doctor. They had to get their numbers. If the numbers are abnormal, they had to take a course to keep the cost of their healthcare down. And they said, at first when I heard that, I resented it, but I'm only here today because you did that. I'm alive today because I had heart disease. I had cancer. I had, things going on. The one story I remember the best is that Hilti is all over the United States, and somebody drove from Cleveland to Tulsa, Oklahoma to be with him for a moment and say, I just wanted to tell you, I'm a single mother. I have 3 children, and I'm only alive today for my children because of what you did with our health benefits and requiring me to go do that. I never would have gone and done that. But you saved my life, and you saved my children's parent. My children's moms have to have me be here for you. And he said, I have 40 stories like that because of what we did. And while it was change and there was this disruption that everybody's so afraid of, it was worth every second of it. So that's why I do what I do today. And that's what Converging Health is all about.
So grew up in Florida, came out to Texas where I did my residency and went into practice. And over the next, it was 15 years, 13 years, we built a primary care practice. I'm a family doctor. I still practice medicine. I still see patients, but only now a half day every other week. I was full-time for decades. The big thing that happened to me is 7 years into practice, I had 3 patients die in their 40s. One of them was my best friend. And I'd seen all 3 of them within 90 days. And all of them, when I looked at their lab work and things, there were problems. One of them, he had a spare tire around it. And so today we know he had metabolic syndrome, but back then that wasn't a term. And then he died of a massive heart attack. And that was my best friend at the time. And there were 2 women. One had type 1 diabetes, but she wouldn't titrate or increase the insulin dose because she was afraid of hypoglycemia. And her hemoglobin A1C was too high. And she died asleep at night. And her husband woke up in the morning, reached over and said, "Good morning, honey. Would you like some coffee?" And she was no longer with us. And the third one was a woman who smoked and had a strong family history of heart disease. And her cholesterol was too high. She was on a hike out in Colorado with her 2 daughters, and she collapsed. And by the time they got her off the mountain, she was dead. A very terrible experience for all 3, but particularly for the 2 kids. And these were my patients. I'd seen them within 90 days. So what I got clear about was that that I was thinking that I was a symptom treater, and I would say, "How do you feel?" was my first question when I saw people. But actually, I was a risk management expert. And to the degree I could get to know a patient and they would trust me, and I could have them do things differently before they hurt, before they had the heart attack, or were diagnosed with stage 3 or 4 cancer, or they got to the point they needed surgery on their joints or on their back. To the degree I had that kind of primary care faithful relationship, I had to be there for them, and they had to really do things differently while they still felt fine. So this is a different technology. This is not, come see me when you're sick or come for an annual physical. This is, let's assess your risk, and then let's change your risk. And this is, again, at a corporate level where I've evolved to today with the data analytics we've got, and we'll come back to that in a minute. But to finish the story, so my practice switched from philosophy. So we became called Tiana Health. Tiana is an Eritrean word that means whole and complete, physically, emotionally, spiritually, socially, and financially. Because we got really clear about the whole person has to be appreciated. The whole person has to be taken into consideration to touch, move, and inspire them. And I don't use those words lightly, because it is touch, moving, and inspiring people to live a different life when the tyranny of the urgent and kids, work, spouse, social activities, financial stress and pressure are all driving us to behave in that default way where we aren't really conscious of 10, 15, 20 years from now and what we want to achieve and who we want to be in our lives. And we just are dealing with the tyranny of the urgent. So it took a different technology. We brought a psychologist into the practice. We had a chiropractor who did physical therapy into the practice. We had a dietitian who came into the practice. And we started asking people, hey, what's important to you 30 years from now? And then I would look them in the eye and I'd say, you're not going to make it if you don't change your behavior. If you don't get your cancer screening, high probability you won't be here for your grandkids. If you don't get these numbers to goal. And I wrote the book, John, you talked about books. The reason I wrote the book, The 7 Numbers That Will Save Your Life, is because I had to raise the health literacy of the people I was seeing. 90% of Americans don't understand what's happening in their body. They don't understand how much power they have over their what we call today epigenetics, which is, John, you, Steve, and I, Lisa, we all have one gene in our body for diabetes. We have another gene in our body for not having diabetes, and our lifestyle turns on one of those or another. And that's overly simplistic, but people choose. And I don't mean to be critical. This is not a blame shame conversation. This is an opportunity and aspirational conversation we're having. But through our lifestyle habits, we choose whether we're going down the pathway to diabetes or not, to heart disease or not, to musculoskeletal issues or not, to allowing cancer to grow in our bodies or not. And that's a beautiful message because it gives you tremendous power, but it's also a difficult message because everybody has to take responsibility at some level for their choices and the consequences. So anyway, sorry to ramble about that, but I think it's a very essential point to my life. Is my goal in life is to give every person the opportunity to make choices to live a long, healthy life. And so as a corporate leader, one of my themes that you'll hear when I work with a company, which we work with a lot of them now, and it's very exciting, is give every member and family member that's on your benefits the opportunity to live a long, great life. Because what I see in America today, there are millions of people who would never have had that heart attack if they knew that they were at risk for that heart attack. They would never, John, to go into kidney failure if they understood that they had a problem with kidney failure. They never would have, had their liver fail if they'd thought about it. And they never would have ended up with that joint surgery if they'd realized that their habits and behaviors were driving that. So my thing, and my family's middle class. My dad was the first professional in my family. He was in Iowa. He got tired of freezing every winter, and he decided he wanted to move to Florida. And being a doctor was the way to do that. So he was incredibly motivated to become a doctor. And so he kind of broke out of, the preacher, teacher, butcher, and farmer, which is all the rest of my family. And but what I'm seeing with my family right now is they're being devastated by healthcare. They don't have a great retirement because instead of having $1 billion, as Dave Chase says, instead of having $1 million at retirement, they have $10,000 at retirement. And that's because healthcare is so broken and the incentives are so misaligned. So I'm being very long-winded, and I apologize, but kind of inculcating some major concepts into the kind of history of my life and where I got to. The next thing that happened to me is that group, we got to 13 clinicians, and that's nurse practitioners, physicians assistants, and doctors. We were bought, and I became the chief medical strategy officer for a group of 343 doctors, 182 offices. And I took all the tools to engage people and touch, move, and inspire them, which is really the key, understand their why that would have them go do things differently, and raise their level of consciousness, shift from a victim mentality, which is the default mentality, to a creator mentality, because mindsets are the first thing that has to change. And so we started to do that in 182 offices, and we grew to 510 clinicians and 240 offices. Eduardo Sanchez, who was at Blue Cross Blue Shield, called me up and said, "Hey, you're $17 per person per month less expensive. You're taking care of 400,000 Blue Cross Blue Shield members. That's $5.4 million a month that's not being spent. What are you doing?" And I said, "Oh, we're a risk management company." So that, we started getting bonuses, and we really, this is 2006, 2007, 2008. And he's like, "Why are you doing this? Like, why would you go to all this work? Because we're paying you fee for service. All you have to do is throw codes over the fence and money starts flying back at you," which is the very broken fee for service system we are in. And why would you go do all this work? And for me, every time I close my eyes at night, I see my three friends from, now it's 30 years ago, but their children. I saw Facebook last year, the woman who lost her two daughters, there was their family reunion on Facebook. All right. And she's not there. She never got to see her grandkids. She never got to see anybody graduate from college for her children. And so I think of them and get up every morning, and I'm very motivated to make things happen, and for the right reasons. And that's where, with corporations, giving people the opportunity, like the president of Hilti I talked about, is really so important.
Those are powerful motivators for sure. And as a diplomat for the American College of Lifestyle Medicine, 90% of what you just said is music to my ears. But as a former hospital president, I have to say, guys like you cost guys like me money because they're keeping patients out of my hospital. Tell us what happened to your company after it got bought, because I think that's an interesting and important story.
Yeah, and guys like you have the power. What happened is that 2010 was approaching, and there's a woman I worked with at one of the large hospital systems on, just coordinating care and some of the quality things. And she came to me, actually, I have to give her credit. Her name was Amy. And she came to me and said, "Hey, Scott, we have 17 hospitals. You have 510 doctors. What if we did an ACO, this new thing that President Obama's talking about, and let's take risk?" And I was like, "Oh, that's so exciting, because if we change the incentives, we'll change the behaviors and we'll get where we want to go." So long story short, we started to meet with the hospital system. In the third meeting, they said, "Hey, we'd like to buy you because having a single tax ID would work better." And then I was like, "Oh, crap. Okay, whatever." So I pulled my CEO and president. They're very capable guys. And so the hospital made us an offer you could never refuse. And a year later, we were sold. And 90 days after that, we no longer had any of the things I had created on the value side. And all of the people, I had 36 people, they had been reassigned to hospitals or HR or IT or whatever. Now, non-for-profit hospitals can look like really lovely things to have in a community. That there's wolf in lamb's clothes there that you have to be thoughtful about. And I went to the chief strategy officer and said, "Dude, what just happened? I mean, we were supposed to form an ACO. I was supposed to run it. We were going to go out there and change healthcare." He's like, "Scott, when we got the list of your doctors and we looked at the revenue flowing into our company and to the hospitals from the doctors, it was down $100 million in the last 12 months. And that's unacceptable behavior. You don't understand. You're hurting our hospitals, and we could have had to close one down, in which case, that would have been a disaster for the community that we support and serve, and all those doctors and nurses." And they were non-for-profit. I'm going like, "What are you talking about? You don't pay taxes." He's like, "Well, but you got to realize all the people that live there spend money in those communities. And so we are the lifeblood of those communities. And we could have had to shut one down." I said, "Let me just get this straight. We were keeping people healthy and well. They weren't being hospitalized, and you bought us to shut us down because that was hurting your hospital revenue." And he said, "Exactly." He said, "Now, 5 years from now or 10 years from now, when Obamacare actually pays us for that, then we'll want to hire you back and we'll want to do this. But until then, that's not what we're going to do." And he told me that out of respect, because he was the one who told me I was going to run the ACO and things. And he said, That's not going to happen. We can make you a chief medical officer at a hospital somewhere, or you can, find a way to leave, and we'll make that graceful. But if you go to the press, I have 17 lawyers and we will destroy you. I mean, he was very clear. I had a clear choice.
Wow.
And I chose A. I had 4 kids in college.
Yeah, that sums up the conflict right out of the gate, doesn't it?
Scott, there is a sense, at least in our community, that fee-for-service and primary care, like oil and water, and it's not possible to create healthcare value, better outcomes, and lower cost in a fee-for-service market. Yet when I heard your stories, how did he do that? Give us some idea. When you're getting paid, what, $150 a visit. I do recall something about a seasonal, you were slower in the
Oh
summer.
yeah. So
Tell us about that.
absolutely. So, the thing I'd say is, if you never tried it, how do you know it doesn't work? And the thing is that, theoretically, people get up in their head, their default way of living is they try to figure everything out in their thoughts. And it's logical to say, well, if you slow down and see fewer patients and you're going to throw less codes over the fence to insurance companies, you're going to make less money. Therefore, a stupid idea to slow down. And the key to advanced primary care is to slow down and build the most important currency that you can possibly build that makes every difference in the world, and that's trust. So you have to spend the time. You have to look people in the eyes. You've got to quit typing behind the computer. And the logic says, well, that's going to slow you down. You're going to send in less 99213, 2 and 5s, and or 205s, or 4 3s, because you're going to see less patients. But here's the dirty little secret: our revenue went up 32%, because what we did is we increased the comprehensiveness of care. It doesn't, I had a talk with my doctors who ran mills, and I'd say, look, guy, you're running a mill and you're doing nothing. You are not improving the quality of life of people. You're coming in, throwing antibiotics at them, giving them a referral to some specialist somewhere. You're not building a valued relationship with them. This is not primary care. This is some sort of urgent care nonsense. And frankly, I'll fire you if you continue to do that, because I was in charge of quality, and I was the chief medical and strategy officer of our company, and so I had complete authority over hiring and firing the physicians. And I didn't have to get that dramatic with most of them, but I'm making a point, because what we did was we took data. I hope people hear that. And we looked at what these people need. Now, our model was physical, emotional. Emotional is not what a doctor does well usually. Spiritual, which is purpose. And we need to know everybody's why in order to be able to touch, move, and inspire them to do things differently. So when I say the word spiritual, don't shy away, because it's like, oh, we can't talk about religion. It's actually understanding the why. And it's going from a soap note to a hope note. And for those who wonder what that is, Wayne Jonas wrote the book, How Healing Works. I would encourage everybody read it. And he describes in it how you shift from a medical mechanical model to an actual model that works in improving health and well-being. And that's the hope note. And then we would, and then we would take the work, the 27-hour day. There's an article that says for a family clinician to see 20 people a day and do everything that's needed, it would take 27 hours. Well, that's nonsense. I mean, it's the article's right, but nobody's going to work 27 hours. You can't, right? Of course, it's only 24 hours a day. So what we did is we took the data and said, okay, so physically, we need to make sure we get all the information in, receptionists and MA, it's your job to make sure the chart's updated. And when they come in, MA, here's the things you have to do in the pre-visit. Protocols, the term protocol means you don't need a doctor. If this, then that, if this, then that, if this, then that. The data would be run against that person's profile, and it would say, do this, do this, do this, do this, which is something we perfected, today in a clinical model. So then we'd hand off the protocols to the MA. She'd order everything before the doctor comes into the room. And we had all the preventive things on there. Give an immunization, make sure they get their physical done, make sure they get their blood work done, make sure that they're getting their cancer screening done, and so forth. And all of those things generate revenue. All of them generate revenue. So we haven't even gotten to the doctor yet coming in the room, right? And we just increased the revenue of the system. And this is why I was so excited about working in the hospital system, because they had all the imaging centers, they had the lab, they had all those things that were generating additional revenue. And that would now flow back in part to the primary care clinician who is doing this broad-based thing. But in any case, it stayed in the system. And even at the primary care doctor level, let me make this point, the revenue is up 32%. At the system level, it would have been even more dramatic. And so now the clinician comes in the room and their job is to build trust. It's to build trust. It's not to be a secretary for the insurance company and make sure the HCC codes are all coded properly and make sure the gaps in care are all closed. All the nonsense. We've turned great clinicians into secretaries for insurance companies in the United States, and just gets my blood boiling. So that would all be done before they got in the room by the team around them. And then when they left the room, they had to have a navigator, someone to help them navigate the system to actually get things done. As the doctor over in Jamaica Hospital we work with said, it was Groundhog Days. I'd go in, I'd spend my 7 minutes, I'd tell them what to do. We'd get up and leave. 3 months later, I'd come back, I'd have the conversation. Nothing had been done. We'd have the same conversation again, and nothing would get done. And I was watching people have bad things happen. But the key was that back end handoff to a navigator or to an advocate, whatever you want to call them, to actually get things done, which makes a lot of money for the healthcare system, right? Because they actually get the cancer screening done. They actually get that specialty follow-up done. They actually get the imaging they need. And so at a system level, fee for service is Christmas if you practice value-based care. And at a primary care doctor level, it was worth 32%. So we took our doctors, now this is 2006 to 2010, from $98 per encounter to $132
Wow.
per encounter.
Impressive. Yeah, no, that's a great example of how you can actually do it. Although I think the hospital's perspective on a lot of this is, screening's good, but I make a lot more money with cancer, and then, it's echoes are nice, but I get a lot more money doing a coronary artery bypass.
Yeah.
So I do understand the other side, but I'm not advocating it because I'm like you, I'm all about prevention of chronic disease.
Let me just say, when I talked to the chief strategy officer, he said, Scott, you don't understand. It's our fiduciary responsibility to keep the hospital strong and vital. That means we've got to do all those cases you just talked about, right. And generate those big dollars. And you were threatening our system. Not you, Scott, but you, the company, were threatening our system. And so we had to stop you. And that was my Pelican Brief moment. It was like, what? And he said, yeah, no, it was my responsibility to shut you down for this health, the financial health of our non-for-profit hospital, which, by the way, was putting nearly $1 billion away in surplus and was paying their executives, anywhere from 1 million to 3 million, depending on whether you're vice president or the CEO per year. And the thing I appreciate, John, we need to go back and look at the MHA degree because it means missing healthy alternatives. And it teaches the thinking that healthcare administrators across the United States have, which is very 20th century. It's very unconscious capitalism. We need to move to conscious capitalism for those folks.
Yeah, and I'm not defending them, but in a very heavily laden fee-for-service world, I kind of understand it. Those are big numbers.
Scott, I love listening to you because so much of what you say resonates really well with me and what I believe is wrong and could be right with the healthcare system today. And a couple things that you said, the tyranny of the day. I often refer to our healthcare system as a break-fix shop right now, right? Because physicians face every day patients coming in with something wrong. And so they get caught up in fixing the something wrong, that the preventative part of it, the instilling hope and all that, which is why all of them went to medical school, doesn't ever get a chance to get into the picture. And I'm wondering how do we pivot our healthcare system to do what you did and what you're espousing in this conversation today? And, if you were to pick like the top 3 things that you would want to fix, what would they be?
Well, mindset is where it starts, right? The thing that we have in America is this default way of living where it's do have. And what I mean by that is if I want to have this, I need to do this. If I want to have this, I need to do this. So the game I have to play is to do this as many times a day as I can. And, and what we know is that doesn't work because willpower is not enough to get you where it's weight loss or it's exercising more or what have you. Willpower is not enough to get you over it, and that's because and the way you fix that is you acknowledge and you understand it's just what's important to me. Why am I here? I was put on this earth, I believe, and this is a little bit of my philosophical background, but people are here for a purpose and you have things that only you can do and you need to get on it and in the world. And if you're not doing those things, then you're going to be miserable. You're going to be unhappy and you're going to have terrible things like diabetes, hypertension, high cholesterol and things happen. But if you get in touch with your why, and you understand who you are as a human being and what's important to you, then that informs your behavior. Your behavior then informs the outcomes. So the only way to have sustainability and power in your own life is to switch from do have, do have, do have, which is, by the way, what we call the Cartman triangle would describe that as the victim mentality. Because what happens is it's like, here's my problem, and you focus on the problem, and then you try to solve your problem. And to do that, and you feel like a victim of that problem, is the mentality. It's the mindset that one finds themselves in, and
Right.
that's normal. And then you're looking for a rescuer to come in and fix that. Well, the problem is the rescuer has so much power in your life. And as you pointed out, Lisa, a lot of doctors go into medicine to rescue people. So it's a systemic problem. We have to shift their thinking into, hey, I'm going to help that person become a creator. As I used to say to my patients all the time, I don't eat for you. I don't sleep for you. I don't exercise for you. I don't go to the doctor for you. I don't take medication for you. I don't get cancer screening for you. There's one person in this room right now who's going to determine how long and how well you live. And unfortunately for me, because I would really love it to be me, but it's not. It's you. So how do I touch, move, and inspire you to get done what we have to get done? Because I'm looking at you right now, and my pulse is up, my blood pressure is up, because this is not sustainable. What can I do to help you? And so you have to put responsibility where responsibility belongs. You have to be loving and keep them accountable. And you have to shift from the I'm a victim of my life and the tyranny of the urgent. I don't have time to do things. I can't exercise. I can't lose weight. I can't make more money. I can't do the things I do. And I have this terrible, persecutor, and I need a rescuer. You shift that to, you know what? I'm here for a purpose, and I'm going to get in touch with that. And that will inform what I do. So now you become a creator of your own life, is the term that's used in this. And this is not me. This is psychology. This is science. And then you look for a coach or someone to teach you new skills so that you can overcome your challenge. So the persecutor becomes a challenge, the rescuer becomes a coach, and you go from a victim to a creator of your own life. So that mentality, we teach that to the doctors, we teach that to the receptionists, we teach that to the MAs. I wrote a book called The Art of Medical Leadership that Susan Oran, who is the leadership coach of that company I told you, we actually kind of automated this. We have a program that we put doctors and their staff, it's important, and their staff through, because you've got to take that 27-hour day and break it into 4 and have 4 people with 6-hour days, which requires a different mentality. So number one, to answer your question, Lisa, is you start with the mindset. And if they don't have the right mindset, you're trying to push a rock uphill and you're just going to get squished. So mindset matters, and it's the first thing you have to address when you're making that transformation from fee-for-service to value-based care. 2 is you got to have the data. You've got to have the things that says to the receptionist, hey, here are the people you need to be reaching out for. We have this in Converging Health, we have the whole person risk score. It informs who needs to be seen today to keep bad things from happening to them, and what they need. Here's the list of things they need. So it's really a matchmaker, right? Get them in, get them to build that trust with the clinician, in this case, probably primary care, get those things done. And what we see is that the percentage of people that go from high risk, low cost to high risk, high cost, your catastrophics that everybody loves to talk about, we can get in the average company, it's about 15 to 18% of people go from high risk, low cost to high risk, high cost. We've gotten that down to as low as 11%. That means that 4% of the people, which is about 25% of the total number that would be having a problem, don't have an event that year. They don't have a heart attack. They don't have a stroke. They're not diagnosed with stage 3-4 cancer. They don't have that inappropriate surgery that, Steve, I know you have a lot to say about musculoskeletal health. That is all prevented. And so that means millions of dollars for the company. So the second thing I'd say is you've got to have the data, and you've got to be able to hand it off to the people at the right time to go do the things that they need to do.
Yeah.
And the third thing is that nothing that I've said doesn't say make more money, be more successful financially. Now, it does, John, as you said, to the hospitals if they keep the same patient base. But the game we were going to play is there's a first mover advantage. Build the number of people that are in your catchment, your net, because people really respond to this message. I live a better, longer, healthier life. Don't be sick. Don't die early. And then you have to expand your footprint, because the percentage of people, as I just talked about, up to 25% of those expensive procedures hospitals rely on could go away. So you have to increase your base. So don't see this as we can't make as much money. See this as we've got to do things differently. And for the hospital administrators and insurance companies, hospital administrators out there, this is going to happen. It's not if it's going to happen, it's when it's going to happen. And I'd really encourage them to get ahead of it, because if you're behind that curve, it's going to be painful.
Yeah, no, I agree. I agree. And for the hospital administrators out there, do the things you do well and continue to do them well with high patient experience, patient satisfaction, and focus on those things and stop doing some of the things you don't do well just because you think they're high revenue secrets. It's a little more challenging in a highly regulated state like ours sometimes, because we can't stop services that are both sometimes losing money and actually might be high risk, like a very low volume obstetric care, and I know down in Texas where you are, it's a much less regulation. It's a pretty much freewheeling.
It's wild, wild west. Yeah.
So that's a whole other, but I think to summarize what you've just said, it's really going from the short term, immediate gratification, immediate fix my problem mentality that is kind of part of our culture in this country to the long term prevention of chronic disease. And I love the way you put it. And it's funny, I saw a doctor this week myself, and we worked on my goals, and I said, I saw my father in a nursing home for 3 years after he had a massive hemorrhagic stroke after getting heavy and then getting diabetes and getting hypertension. I would like my kids not to have to visit me in a nursing home with a stroke. What can I do to get there? And, guess what? We talked about, exercise and cholesterol and blood pressure and all the things that you and I both know about. But, to focus on your long-term goals is really important. I think for employers, and I want you to comment now how you deal with employers, because employers have a very different headset. And I've tried to stress this point many times. The TPAs, the PBMs, all those folks are working on 1, 2, and 3 year contracts. But employers have employees that stay with them for 10, 20, 30 or more years. So they really have the long-term interest of their employers. And it's more important to them and the inertia for employers to change it. So how do you introduce yourself and your company and employers to get them to embrace this? Because there's a lot of headwinds for them their CHROs are freaking out about changing the plans because they don't want to, like you even said, the little parable you said about the tool company, the employees initially got upset.
Yeah. So whether it's the specialty drugs, that's only 2% of your population, or it's requiring the entire population to do things differently. There is the D word, right? Disruption, which just absolutely has HR's head start spinning and green stuff start flying around. It's just, yeah, but it's not real. I mean, the thing is, I've done this now dozens and dozens and dozens of time, and there's a shift, but the shift is appreciated by the staff. And the shift is actually, if you don't do it in a high deductible health plan where you say, oh, you got to go do these things, and now it's going to cost you a fortune, we're going to bankrupt you. That's not a good plan. You have to have plan benefit design that actually serves. But John, you know the answer to that question already, and that is it starts with mindset. And the way that you shift your mindset as a corporation is you get intelligent data. You get data that looks at the clinical health of the people in your, with our data at Converging Health, what happens is we take claims data, which are the medical claims, the pharmacy claims, and eligibility. We can also add everything else. We can put EMR in there if you have it. We can put biometrics if you have it. We can put participation in point solutions if you have it. Well, we've got the whole capability. But what comes out is, here, to keep it simple, here are the 4 quadrants. And here are the people who are healthy, you want to keep healthy. And here are the people who are at high risk that are going to become your catastrophics. And 70% of the time, if the people who are high risk, low cost get responsible, proactive care, they will not have that event. And every person that doesn't have that event is going to save you, corporation, $30,000. So like the company I talked about, we went from 15 to 11%, and that company was 1,000 people ish. When you looked at the savings, it was $350,000, $400,000 a year in non-events. Plus,
that's just, let me interrupt you, Scott. That's just direct costs. You're not even talking about the time away from work and all of that other costs that are laden in there, right?
Exactly. So the point is that it ended up being millions of dollars. I wrote the book Which Door, which is a true story, but I did it in the form of a parable, kind of to protect the innocent kind of idea. To have, and it's an hour long that's free. Just do it while you're out driving or walking. You can do it in one trip back and forth to work if the average person commutes 30 minutes. And you'd see what it looks like to make this shift. And what happens when people listen to that, like literally, I have a company I work with down in Florida that the HR person listened to the book. She gave a copy of the book to her CEO and CFO. I was hired 2 months later. We generated the data, and now it's like specifically, here's what you need to do, period. And then it's the question of how do we do that? So it starts with mindset, get the data, understand what would really change the lives of the people and that would really honor you as their leader and them in having them be more productive, as you said, but also live and not have disabilities and things. And then 3, just take it one baby step at a time. And I guarantee you, if you have the information within 2 years, you'll have a different culture. You'll have a proactive, caring culture. This same railroad company I just talked about, their culture committee said, we want to build a culture that is proactive and people know how much we care, and we're willing to remove barriers of care with high deductibles and things and give them access to direct primary care, give them access to non-local virtual primary care where they live in the middle of the country, which is common when you're taking care of railroads. And we want them to appreciate that. And the employees picked it up. And now we do a monthly podcast where they ask me questions live and I just answer the questions, and we're helping create a different culture. And I literally got hired 6 months ago by them.
That's
so
great.
It's kind of get out of the way, get the data, and let things happen in an organic way that builds culture, decreases turnover. The thing, Lisa, with the medical group, with the Art of Medical Leadership with Susan Aron, we took MA turnover from 70% down to 30%, which isn't great, but it was, when you're competing for MAs with hospitals, they can pay a lot more. We took our physician turnover. New physicians would join our group. We went from 343 to 510, and we lost 15% of them because the pace of change was too high. We got that down to less than 5% because we changed the mindset and they embraced change instead of fighting change. And so, John, the answer to your question is a corporate leader, get the data. It's not expensive. It's like literally for the year, if you prevent 2 or 3 ER visits, you'll pay for the whole thing, and then go through it, start to think differently. It'll, when the student's ready, the teacher appears, and the teacher's the data. It's actionable, intelligent, clinically oriented data.
Yeah.
Yeah. Steve?
I don't want to leave the topic of data without saying a couple of things here. So I ran an orthopedic service line, for which John was president for a number of years. Very busy. We covered joints, spine, sports, and trauma. And we were remarkably able to change the mindset, as you've used that term, of up to 40 orthopedic surgeons, most of them private practice, and none being short on ego. But we were able to change their mindset by focusing on the value equation, looking at outcomes over the true cost. And I would say that the hospital, John, you may agree here, the hospital has plenty of data too. It's just that the data was often different. We would sit down with the hospital monthly, and the kind of data they were interested in were the RVUs of our docs, the productivity of our docs, a number of referrals, the network integrity. Whereas we, as an LLC running the business, we're interested in the patient-reported outcomes, the cost of delivery. So sometimes there's a data disconnect. Everybody's collecting data, right? It's just what's meaningful data. And I just want to dovetail into one other thing, because it really, really is important. So I know the folks on this podcast, and that concept of purpose, whether you call it spirituality, but it really does matter. I'm a big fan, as John and Lisa know, of Dan Pink. I've learned so much from I'm reading his latest book, How to Be a Salesman. But, we do have to be a bit of a social scientist. And the one that started me thinking back in 2009 was the puzzle of motivation. And when I read about autonomy, mastery, and purpose, it became clear to me why our organization, the Connecticut Joint Replacement Institute, was so successful, because we gave docs back the autonomy and purpose, and they got really good at doing what they were doing. So where I'm going with that is, Scott, when I talk through my other interests, when I talk to primary care organizations, whether they virtual, direct, or APCs, one of the questions I ask is, are your doctors happy? And because it makes a difference. I'm not sure a lot of the docs around here in fee-for-service are really that happy, really fulfilled. Do they sense that purpose that you've been able to get out of your position? So what are your thoughts on that?
So we believe in the quadruple aim, and the fourth part of that is the provider, clinician satisfaction. I mean the receptionist all the way up to the top doc. And what we've seen, we do a survey for the companies I work with every 6 months. And what we've seen is when you get people in touch with their their why and touch, move, and inspire them, they kick rear end and they come to work every day and they're excited to be there and it matters to them. When they're stuck in the tyranny of the urgent, feeling like a victim that's getting pounded and told, here are the metrics, your HEC code, your gaps in care, or your, how many hip surgeries or heart surgeries you've done, it's miserable. They're just a widget in a machine. And so it's the difference between having a thriving business and having a surviving business. And so I don't think you can run a company in America today, particularly in healthcare, where there's so many options, and not be making this shift to purpose.
Totally agree.
Yeah, so true. Scott, let me ask you, I give a lecture to Quinnipiac medical students on prevention and screening. And, medical education from the time, you went to med school, which I guess in the 80s, and I went to school in the 70s, it hasn't really changed that much. It's still focused on diagnosis, treatment, which kind of perpetuates this acute care kind of mentality. Do you have a lot of interaction with students, residents, so they get introduced to this concept before you try to change folks from being, as you pointed, on the mill to this, longer term preventative approach to behavior change for your patients?
So I told you I came from a family of teachers. My mom's a teacher. My grandmother was a teacher. And, the thing is that they want what's right also. But what's happened is right now, the intellectual, direction that they're getting is 20th century. And we've got to update to 21st. Now, with technology, one would hope that would be possible. And we'd be able to get more athletic. And we start to embrace these principles, Steve, that you and I just talked about, that really talk about how you touch, move, inspire, and make a difference in a person's well-being. And it's not being incorporated. And the doctors that are being educated today, and my dad's a family doctor, I'm a family doctor. I still practice medicine. I still see patients, but only now a half day every other week. I was full-time for decades. My daughter's a family doctor. My daughter's just gone through that educational system, and she went ahead and got board certified in holistic and integrative medicine. So did I. And it's work. You have to force the system to let you do things differently, because they're trying to teach this antiquated, mechanical, allopathic, it's physical. It's your car. We change your filter. We change the oil, instead of you're a whole person. And that, again, at Converging Health, we have the whole person risk score. We're looking at physical, emotional, social, financial, and, kind of purpose-driven things. Yes, you're right, John. We need an overhaul of medical education. And I believe there are people that are going to make that happen. I have great faith that this next generation, as we get rid of these antiquated leaders who don't get it, will bring these concepts into education. And the faster they do it, the better off we are.
Great.
Well, on that note, Scott, thank you so much for joining us today. And
Great.
Steve and Lisa, thank you. And we really, really appreciate it, Scott. We look forward to working with you again in the future.
The pleasure's all mine. Anytime I could meet with people, talk with people, have people see a different way to start thinking differently, because the mindset's the first thing that changes. And I've been so honored to be on your podcast today. Thank you so much.
Thank you, Scott.
Thank you.
Thank you.
Bye-bye.
Bye-bye.